So what about the 4K score and other biomarkers that are used in the prostate cancer screening process? There are a variety of biomarkers that patients often bring up. There's the 4K score, there's one called the Prostate Health Index, and another test that can be performed, which is called ISO-PSA. So the 4K score looks at four different components in its blood test. It is the total PSA, the free PSA, the intact PSA, and human kallikrein number 2, I believe it is. So what value do these tests add on top of the normal just total PSA or the free PSA that we sometimes will get with it? I think it's important to note that these studies have looked at these tests and have shown some increased utility over just the PSA alone. I think it's also important to note that most of these biomarkers were developed before prostate MRI had really taken off. So without having had access to prostate MRI, I found some of these tests a little bit more useful. In the era where prostate MRI is so readily available, it's hard to justify their cost when compared to how little information they provide compared to an MRI, which tells you, one, is there a lesion of concern, and two, tells you where the lesion is so that you can target it. So would I ever use these? I mean, I can't remember the last time I've ordered one. It's been at least 5+ years. The only situation I could think of would be a patient who had an absolute contraindication to an MRI, like some type of metal implant. So while these tests had promise in their era, I think in the era of prostate MRI, they just don't have much utility.